This is One-on-One. There he is, Dr. Jock McCullough, who is cardiac surgeon at Hackensack University Medical Center. Good to see you, doctor.
Thank you very much for having us over.
You have brought some excellent props, some visuals that will really help us here. Folks, we're talking about some interesting stuff, cardiac stenosis and valve replacement, right?
Yeah, specifically, Steve, this is about aortic stenosis.
Aortic stenosis. Do me a favor, doctor. Talk about what viewers are seeing right now. You see what they're seeing. Describe it.
Yeah, this is a
It's like
cutaway.
you're a weatherman right now. Go ahead.
Okay. This is a cutaway view of the heart. And what we're going to talk about today is aortic stenosis, or narrowing of the aortic valve. This is currently the most common valve disease that we have in this country and in the world. And the problem with a narrowed aortic valve is that there's no medical therapy for it. Once you develop severe aortic stenosis, your long-term survival becomes quite limited. And if you can't have an open aortic valve replacement, then your prognosis, you're not going to do well. There's
Now,
no
where
good
is it here?
prognosis.
Where's the
So the aortic valve is this valve here. And in the standard operation, we would put you on a heart-lung machine, divert the blood flow from your heart, open the aorta, cut out the old aortic valve and put a new one in. Now, there are some patients who are just too elderly or frail or have too many other medical problems that they would not survive that operation.
They are not candidates for that open
operation or
Got
open aortic valve replacement, and they're deemed inoperable.
What do you do
And
with them?
They're just palliative care, honestly, Steve. You can try and take some fluid off of their body with Lasix or diuretic, and that's about it. And that's very temporizing, and it's a difficult life for them. They really don't survive.
Okay, but for some others, right? Let's talk about some other options here.
So just in the last year in this country, we've had approved a transcatheter valve. We have a new
transcatheter valve.
A transcatheter heart valve. And ingeniously,
I can put this away now?
You can, yeah.
Okay.
We have a way to put in a new heart valve without a heart-lung machine, without an incision down the front of your chest, in very frail or by definition inoperable patients too sick to be operated on by traditional methods. We'll take well, just to give you an idea of what a narrowed valve would feel like if you try and put your finger, that's a normal valve. And how easy
I'm going to take my finger, as you told me to do before, and describe what it should feel like.
Exactly. You can see how easy it is for the blood to pass through the normal valve.
So my finger's passing through, you can see, and that's the way it should be.
Exactly.
Because what's going on in there?
Normally, the normal aortic valve leaflets have the consistency of tissue paper, and they open up widely when your heart squeezes and it pumps the blood out to your body.
This is healthy.
That's a healthy valve.
Now we're going to move to
a disease valve. As you get older, the valve leaflet's calcified. The trauma from the blood and the constant beating they take cause these leaflets to develop calcification and stenosis. Now,
stenosis, is that a closing?
It's a narrowing. That's exactly what it is. And when your heart tries to squeeze against this narrowed valve, try and put your finger through that narrowed valve, you can see how much more difficult it is.
Whoa!
As it tries to get through that narrowed valve, it cannot, and all the blood backs up.
Guys, I'm actually trying to push my finger through, and it finally comes through, and now I can't even get it out.
Yeah.
What's going on in real life there?
So in real life, as the heart squeezes and tries to get through that narrowed valve, it cannot, and the blood backs up into the lungs. They feel very, very short of breath, and they can't exert themselves in any way. So now they're too sick to have a regular operation. What we've been able to do is take a aortic valve replacement.
All right, an aortic valve replacement.
Aortic valve.
What is it? Is that what it's called? What's the procedure called?
Well, this is a prosthetic or artificial aortic valve. The procedure that we're talking about today is called transcatheter aortic valve replacement.
Say it again.
Transcatheter aortic valve replacement.
Is there an acronym for it?
TAVR.
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 T-A-V-R. T-A-V-R.
Exactly.
If you guys want to Google it, look it up. It's T-A-V-R. Go ahead.
Yeah. This is revolutionary. We've taken a regular aortic valve that we would normally replace with open surgery, put it on a collapsible frame. We wrap it around a balloon, which we can put on a small catheter going through an artery in your leg. We can snake that up around into the aortic valve, blow open the balloon, and leave this behind, leaving you with a wide open pathway for the blood to follow now. And the congestive heart failure, the fluid backing up into the lungs is all alleviated without the heart-lung machine and without all the trauma of an open heart operation.
Wow.
So people who were felt to be inoperable now are not. And the results have been paradigm shifting, to use a...
But one of the things that's really amazing about this, Doctor, we were talking about this before we got on the air, is you said a fair number of people who are experiencing this
Aortic stenosis
don't know it?
They know it. They may have been told they have aortic stenosis. The problem, Steve, is that the studies have shown that up to 40% of patients with a narrowed aortic valve who could benefit from getting a new valve are not sent for surgery.
Why?
Either their primary care physicians think they're too old or frail, they're not aware of the new technology, the patient themselves or their family think there's no way they could undergo open heart surgery. And the big problem, as we keep saying, is that there's no medicine for this. You know, it's a mechanical problem. It has a mechanical solution.
Someone says, give me the right pill.
There's no pill for aortic stenosis. Nothing will reverse this. It's a mechanical problem for which there's only a mechanical solution. 2 years ago, we didn't have one. And now this is truly, you know, revolutionary.
The technology here is driving the protocol.
Yeah, exactly. I mean, the biomaterials, the things that would allow you to create this valve are, you know, certainly space age, that you can wrap this around a catheter and go up through your leg. When I first saw this about 12 years ago in a movie on a dog animal, I said there's no way this ever becomes prime time.
You said no way.
Absolutely not.
And here it is, prime time.
Here it is. And I'm doing it, you know, we do it at Hackensack 2 or 3 times a week now. And we've done it in patients upwards of 95 years old.
Oh my God.
Patients over 90 who have previous heart surgery. Many of them are able to go straight home. They don't have to go to cardiac rehab, and they do really quite well.
Dr. Jock McCullough, this is good stuff. You're a cardiac surgeon. The technology is moving forward, but physicians and patients have to stay with it, and that's why you have to get important information, and you provided it. And I want to thank you very much for being here. The doctor is in the house.
Thanks.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the New Jersey Education Association, working for great public schools for every child. Investors Bank. PSE&G, committed to improving New Jersey's economy and strengthening its communities. New Jersey Manufacturers Insurance Group, auto insurance, homeowners insurance, and banking under the principle of stewardship. The law firm of Gibbons P.C. Health First New Jersey. Cohn Resnick, providing accounting, tax, and advisory services for more than 90 years. And by N.J. Best, New Jersey's 529 College Savings Plan. Turn a dream into a degree. Promotional support provided by the Star Ledger and NJ.com, Everything Jersey. And by NJ Biz, All Business, All New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.